you on the call?
Well, good afternoon, everyone. Thanks for joining us here. Appreciate everybody spending time with us and taking some time out of your day to hear some of our thoughts from our recent trend report. I'm Paul Fahey. I'm a vice president with Smith & Jones and our affiliation and partnership with Over It Media, located in upstate New York. We're just really quickly marketing communications firm, focusing and specializing in just healthcare, hospitals, health systems, and we do a lot of work for branding, service line promotion, recruitment and retention campaigns, market research, public relations, and so we'll cover a few of those topics as we go on today. So again, thank you to everybody who's joining us here on Zoom. This is currently being restreamed live on Facebook as well as LinkedIn. And for those of you that are going to be watching this on demand at a later date, this is being recorded on October 29th of 2020. And I think that's important because some of the opinions and trends and thoughts that we're going to be sharing are with that context in mind now that we're 7-8 months into this pandemic. So I think that's important to mention. So we'll quickly just talk about the situation that's happening around us, just to put this into context. And I know that there's some folks that have registered really up and down the East Coast, and we have a number of people that'll be watching this representing a diverse population. We've got urban, rural, suburban, and a lot of different states. And what that means is we're all seeing this through a slightly different lens. But for the sake of this conversation, I'll frame it on sort of a national view of some of the issues. And then we're going to take a deeper dive into two of the trends from our recent trend report. So many of you joined us at the end of September when we released our annual, and this is our 7th annual trends report. Today we're going to focus on a deeper dive. This is going to be really practical, hopefully with some tips and takeaways that you can adopt no matter what size organization you are. I know resources, both human and financial, are stretched really, really thin these days. We wanted to make this very practical, insights and things that you could put into action without really any significant staffing or budgets. And as we're going through, please use the chat function. I'll try to monitor this as we're going along. But if you have any questions, please put them in the Q&A in the chat as we're going. I'll try to answer them in real time, but if I miss it, I'll certainly follow up with you offline to answer your question. I want to give a shout out to the authors of this. My colleagues Sharon Lawless and Lisa Barone really helped us, and Katie Source also. Sorry, Katie's not represented here in the photo. All really have helped us build out a lot of this content, analyze a lot of these trends and insights over the last 8 months or so. Could not be doing this, would not be here without them. So I really appreciate their contributions to this year's trend reports, and in particular to today's presentation. Really quickly, our methodologies. So since COVID hit, and again, we were doing this from upstate New York, but early mid-March, we started deploying a number of different email surveys, We held virtual focus groups, a lot of one-on-one interviews with industry thought leaders. American Hospital Association's been putting out some really, really good content. Our team does a fair amount of social listening, where we're really tapping into social media, not just as a communication tool, but as a listening tool. And also looking at Google Trends. It's a great free resource. If you're not using it, type in the phrase and you can see how that particular topic is trending over time. So these are a lot of the methodologies that went into forming these insights. These are not just personal opinions, but we're really trying to cull as much robust data as we can into what we're sharing and presenting with you today. So let me start with really just a situation, kind of get us all on the same page. First, I mean, most of you watching this are from the healthcare perspective. Thank you for all the work you're doing. You and your families have been put in harm's way. You continue to go to work every day. And, you know, in spite of all of that adversity and all of those challenges, it really has been a heroic response. This has been an interesting downturn. I mean, this was a shutdown, which resulted in an economic downturn. And frankly, you know, nobody will dispute this. The virus right now is the economy. The stock market's been doing great, largely in response to the only place you can put your money over the last 8 months, since Treasury bills and bonds have been at such low interest rates. Stock market seems to be doing well, but that's not the economy. The virus right now has been the biggest driver of our economy. So as we look at this, you know, we've hit probably the biggest, fastest drop in our GDP ever in history. Not necessarily the deepest, but it really went off a cliff pretty fast. Back in April, we had unemployment rates nationwide around 15%. That seems to have leveled off and now is, depending on where you're at, nationwide, we're looking at about 8% unemployment. But we basically shut our economy down, and now we have to turn it back on. And one of the things that happened, I think, was for healthcare professionals, obviously, deferred and foregone procedures. Patients just simply weren't going in and were just pausing for a while. We also had disruption of supply chain. There was a lot of new technology and equipment that was being embraced by consumers, and we'll talk about that as we go through. And as I mentioned, really historic unemployment levels, and some of that is resulting in a rise in uninsured patients, which will present some challenges for us, you know, as we continue throughout not only this year, but also into 2021. So as a result of that, we have what we were describing as a quarantine consumer. And that, you know, will change. Many of us are starting to emerge and return to sort of normal patterns in our lives, but we think that there's going to be a permanent shift in consumer behavior, and we'll talk about that as well, and in particular what that means for healthcare. And then also the other thing we wanted to focus on today is recruitment and retention. You know, what are the challenges and opportunities that we're seeing really with a lot of our clients, but also nationwide, and I think that poses something worth talking about. So as I mentioned really quickly, this is our 7th annual Trends Report, and really looking at how can marketing, public relations, community relations help, you know, deal with sort of these issues. Throughout the presentation, you'll see this green box, and that's where we're just putting some quick insights. This is where you can find actionable tips and takeaways. And as I mentioned before, things that you can really put into action with a budget or team of any size. We're trying to make this as practical as possible. So we promised you a deeper dive in this webinar, and this is part of our ongoing series. As we launched and released at the end of September our 10 trends, today we're going to focus on a couple of those and into a little bit more detail than we could and had time for back in September. Future webinars will start to focus on others, and we've been making decisions about which ones to highlight, really based on conversations with our clients and feedback from audience members like you, just kind of saying, hey, I'm curious what else you guys think about this, or we just find it's a topic of conversation, so that's what we've been choosing to highlight. So today, we'll take a deeper dive into understanding that new healthcare consumer, a little bit more about his or her background and the context for who they are and where they're coming from. and also recruitment and retention opportunities, challenges, and so we'll focus on what was number 1 and number 10 of our original report. And again, I'm curious, as you're joining us today, please, if you could put thoughts in the Q&A or the chat, I'm happy to try to respond to questions in real time as we see them. But also I'm curious, if what I'm saying isn't resonating with what you're seeing, at the local level, wherever you are. I'll be able to monitor questions in Zoom, but again, for those of you that are watching us on Restream and seeing this on Facebook and LinkedIn, please put questions in the comments and we'll try to respond to those as we can. And again, for those of you watching this on demand in the future, you'll have comments and opportunities to post that on our website. So again, thanks for being with us here this morning. So let's dive in and really take a deeper dive into what was trend number 1 for us, understanding that new consumer and meeting, as a result, the new patient in a little bit more detail. So yeah, March 12th, roughly 9th, depends on where you're at in the country. That was pretty much when everybody decided to go into hibernation, digging in and hunkering down. And so that puts us at about roughly 7 or 8 months, depending again on where you are in the country. But we basically were consumers in quarantine. And immediately we saw a lot of different issues. People were focusing on things that were lower on Maslow's scale of needs. We weren't looking, the way we normally would for vacation destinations and things that might at the time seem frivolous. We were really spending only on essentials. We were stockpiling. There were shortages. And that really changed a lot of consumer behavior. None of us, most of us have not lived through this before. You'd have to go back to the Great Depression for those kind of product shortages, that kind of disruption in supply chain. So it really, I think, hit the psychology of consumers pretty hard. And some of that, I think, will stay with us for quite some time. We really only switched brands in response to supply problems. So people had a loyal grocery store or, a retailer or even possibly healthcare provider. And in general, people wanted to stick with those brands, but had to go elsewhere. Typically what we've seen is when consumers are off balance, post-disaster, or in this case, the quarantine, they really are looking for an even keel everywhere else in their lives, and will only switch brands, when they have to, any other minimal disruption. And I think that poses some opportunities for, and I think I'll talk about that on the next slide, I think that poses opportunities for a lot of us. Everything was then home delivery, drive-in or perhaps drive-through, digital consumption of, most services. And again, that and some of the new technologies that we learned to embrace poses really, we think, opportunities for certainly telemedicine. That's not revolutionary and not why you tuned in. But I think, understandably, that's a huge opportunity because we don't have to educate consumers so much about why or how it works and the benefits of it. They're starting to see, for example, the time savings, with the ability just to have a physician dial up, dial in, we have a quick conversation. I'm not driving, I'm not in a waiting room, and I'm not driving home. And so since we embraced a lot of those new technologies in our social lives, we were Zooming with friends and family, much quicker to embrace those from a healthcare provider standpoint. Consumers were very much also in a wait and see mentality, and that posed challenges for a lot of us as we saw deferred services, hospitals, really and some of us actually had policy issues. We weren't allowed to proceed with elective procedures because of state policies, again, depending on the state where you're at watching this. But no matter what the policies were, or even the policies of our individual hospitals and health systems, consumers were basically saying, I think I'm going to wait this one out. I'm going to see what's happening, not make any major commitments, or certainly not go into places that they might have perceived might be hotter spots for potential COVID contact. Certainly consumers learned that they didn't need as much as they had before. We became and still are very much a consumption-driven society. And so that has its own retail implications, but perhaps healthcare also. And we can talk about that as we go through this morning. They certainly got their entertainment elsewhere. We were consuming a lot more content on TV, and also in the great outdoors. And I think we'll talk about that on the next slide. These changes in a consumer's interest in health and wellness. Certainly, it was something we were talking about a lot more. But they definitely got entertainment in different places. I can't go to the theater. I don't go to the movies. And believe it or not, retail shopping is entertainment. Retail therapy. And as I mentioned before, consumers really embrace technology for work and socialization, and certainly now that has opportunities for us from a healthcare standpoint. Zoom basically is holding our whole country together right now. So meet your new patient. What are those implications, and what does that mean? How does that translate into healthcare patients? Well, our surveys that we conducted recently looked at, half or maybe a third say that they are either the same or a little worse than they were financially. And in terms of their outlook, 2/3 think they'll be better off financially a year from now. So with that in mind, elective procedures, things like bariatrics that might have $1,000 copay, may be back on the table. They may be financially more optimistic and able to move forward on certain procedures. Consumers certainly built up and created a herd identity. This was, and I mentioned identity, not herd immunity, but we now feel like we're part of something. This was something that affected all of us. And as polarizing as things are in other aspects of our lives, whether it's politics or other topics, we did all come together and feel like we were part of something. We could rally around something, and it was something that we were all dealing with. And to my point a minute ago, we consumers became much more health conscious. They were eager to return to normal safely, but we did find, and what we did see in a lot of our research, was that consumers were feeling like they wanted to reconnect with the great outdoors, that they wanted to spend time in more green spaces. They were cooking at home, and how many of us saw pictures of people on Instagram baking bread? But there was an opportunity, I think, for them also to look at activities that are a little more healthy, look at a diet that could perhaps be a little bit more healthy. And so they were thinking about their health care and certainly their safety, from infection a lot more. We did talk about a moment ago their desire to stay with trusted brands. And I think this presents opportunities for all of us. The investments you've made in your brand, those are bonds and those are relationships. Consumers want to stay with those wherever possible. And they'll, at this point, because they're off balance, or when they're off balance, they're only going to switch reluctantly. They don't want a new thing in their lives. They don't want to try to learn something new, a new routine, a new set of procedures, paperwork, getting to know me as a patient, for example. So I think it's important, to keep in mind, as much as we want to ring the register from a service line standpoint, investments in your brand should be considered. Maybe a small percentage of that going to preserve those relationships, because it's going to be easier to maintain that than it is for enticing somebody to switch from another institution. So with that in mind, this new patient certainly has new and different priorities. You're going to be able to meet them on their terms, have them embrace technologies, have them take more control and be more empowered for their own healthcare more than ever before. My point is, they're going to want to meet you, halfway or a lot closer than they might have been before. This is a topic, their healthcare in general, is one that we believe they're going to be more receptive to in the coming months and last 6 or 8 months than they have been before, because A, there's less clutter from other products and services, but B, this is a topic that is of importance to them, and they've been sensitized to it. Beyond that, they certainly have a tremendous amount of trust and respect for your institutions, and I think that poses opportunities from a positioning standpoint. Pillars of the community, and especially those of you that are at community hospitals and health systems, this. You're the largest employers very often in your community. That concept of neighbors taking care of neighbors, now that goes even farther and goes even deeper. And that sense of trust and respect, I think, is really at an all-time high. A couple thoughts that we have in the little chat box in here below in terms of one thing I think is very important, helping patients to be heard. I want to focus on this for one quick second. So because they do feel empowered, because their health is important to them, because they have hesitations, they're wondering about safety and procedures, and is the timing right? Am I open for business? You know, should I be considering that elective procedure? If you don't have a patient advisory committee, I recommend starting one. And if you have one, you know, certainly either restart it or keep it going. Bring those folks together through Zoom. And I think there's a huge opportunity there to not only listen to those representatives from your community, and it could be a whole cross-section of you know, racial composition. There could be people representing different church groups, community groups, you know, just former patients, you know, regional or community opinion leaders. But then, more importantly, put that content back out. Let, you know, on your social media, let people know that you're listening. Let people know who they should talk to, you know, that has their voice, that can advocate for them for new policies and procedures. It's something I don't think our clients are doing enough of, certainly something I think that there's a tremendous value in. And again, just using this as an opportunity to listen to the community and respond to their changing needs. I did mention a minute ago about, you know, relaunching service lines, and I think this is very important to have a really clear moment. If you haven't already, most of you I think by now have said we're open for business, but there are so many gray areas about what is permitted and not very clear lines of, you know, I think I can go here, but in smaller groups and maybe certain times. Make sure that you're out there with just even the most basic messages that we're open for business, we're doing it safely, we're ready to meet your needs. You can't say that often enough. If, you know, there's an old saying that the client tires of the advertising before the public does. And in this case, you know, if you're just starting to get sick of hearing yourself say that we're open for business, they're barely hearing it. So keep going. But I think for the most part, you know, if you're not already, but research or relaunch rather those service lines, you know, in particular bariatrics, orthopedics, maternity. These are services that I think people are ready to start seeing again and embracing again. Maternity is interesting, and again, you know, if you have thoughts, I'd love to see those in the chat or on social media for you watching us on Restream. Early on, we thought there was going to be a big baby boom, and now I'm not really sure. Some articles are saying it's going to be a bust, maybe it's a blip. Either way, we'll have fun calling these folks that are born in this time period coronials, or fast forward 17, 18 years, we can start to refer to them as quarantines. So, but I'm curious, I think with, you know, maternity services, you know, again, I think that's a service line that we can and should start to relaunch. Assessing your media buys. This, I think, is really, you know, interesting. If you haven't done it before, you know, we have a few opinions on this. I mean, because we haven't returned to traditional commuter patterns, because, you know, the morning traffic reports are not talking about, you know, clogged highways, I'm a little hesitant to continue recommending that combination of billboard and maybe terrestrial radio. Those are fabulous combinations for commuters, but I'm just not sure that those patterns are here yet. However, you know, news consumption, you know, in particular, people are glued to news products, and whether that's printed news or online, you know, we certainly were looking at so many issues over the last 6 months, and news consumption is at an all-time high, unfortunately at a time when it's being challenged by, you know, it's when its credibility is being challenged by elected officials. But that said, people I know are tuning in, no matter what station they're watching or what newspaper they're reading to or website they're visiting, and they're looking at issues certainly related to the economy, to coronavirus, to social unrest, the election. We're consuming news now more than we ever have been. And my point being, those are places where you can find your consumers. They're typically very efficient. They're very localized in many cases, your paper of record for your city or your community. news consumption, and then, from a paid standpoint, but also my note here about PR, restart that engine. You've got a lot of great news stories, whether they're human interest stories about your employees, or, even just mentioning that we're open. We want to let the community know that these service lines are back on, or here's what we're doing, and highlight some of those things. Being ready to rapidly deploy digital campaigns, I think, is critical. Having those small, simple ad sets or social media posts ready to boost. Digital will give you the agility to know what you can start and stop. There's very little cost involved in producing these materials. And so as a result, if you find that your census numbers are up and you've become a bit of a hotspot, your ICU is booked, you can quickly, dial back on your digital spend much faster than, calling the billboard company to kind of rip down the vinyl that you just put up a couple of weeks ago. Digital, we're seeing, in all forms, whether it's digital consumption on news sites or your own digital in social media and elsewhere, is critical. Email marketing, again, I think people, because they're taking more control and they're feeling more empowered about their healthcare, the ability and opportunity to inform and educate them, I think, is also important. Make sure that you're putting out good content, clickable content. Make sure that they can jump through to see your website so you can see who's engaging in which topics and stories, but also so that the search engines can find the content that you're putting out there. And even adapting to those new search queries and user needs. As you're listening to what's happening in your community and you're turning on those service lines, I think it's important to have those search ad campaigns ready to go. That's a tactic that I think will be show a good ROI in the coming months. So moving on to the second trend in the other half of our presentation, looking at seizing our recruitment moment, and looking at this from not only a recruitment but retention standpoint. Again, for those of you in smaller communities, you are sometimes the largest employer or among the largest employers in your area. And that has, those retention strategies and how your staff are feeling can go a very long way to, strengthening your brand in the community. And at the same time, I think there are opportunities rather for building workforce development. And the reason I say I think, I think it's an interesting debate right now about how people are feeling about the industry. Certainly, looking at your heroic response to it. But as we talk about it, I'm wondering if that's bearing fruit yet for many of you that are watching this. So as I mentioned before, and we've said this a lot, this is your 9/11 moment. This shines a very bright light on, your staff and the heroic work that they're doing. There's a lot of goodwill that you're building up. The healthcare industry always has been, very highly respected, now never more so. As I look at what's happening in the economy, initially, months and months ago, I would have predicted a flood to people looking to, pivot from, perhaps something in the travel and tourism, retail, restaurant industry into more sustainable careers. I am seeing an uptick for some of our clients that are trying to recruit nurses, that are trying to build for their schools of nursing. But I'm also hearing some feedback about the potential for risk. Do I want to go into a career where I could be putting myself in harm's way? I think the jury's still out on this, though I certainly think we'll have at least the same workforce challenges we did pre-COVID, hopefully with folks seeing that afterward. But my point being, I believe that there's an opportunity right now for you and your brand to promote this. Take advantage of that goodwill, take advantage of how well respected your industry is, and mention to folks that there is an opportunity for them to learn more about this. If there are concerns, if they are on the fence, or even for those entry-level positions that either require no or little training, or even the support that you would give to folks as they might be pursuing a CNA or some other degree, I think there's an opportunity to have a conversation with the public to say, hey, this is clearly an industry that could offer you sustainable growth, and certainly clear vertical pathways, as well as very little economic risk. Would you like to learn more? Please chat with our folks in HR, or if you have a school of nursing, talk to an enrollment counselor and learn more about those opportunities. From a retention standpoint, I mean, building that gratitude on social media is huge. You know, even just those photos that we found so touching of exhausted staff with just the marks on their faces from wearing masks for hours on end. You know, just those public moments of thanks, those moments of appreciation for staff and departments that are going the extra mile. Really, again, I think it helps to strengthen your brand. It helps to raise awareness of the nobility that is within your profession. You know, certainly virtual career fairs are starting to take off a little bit. I'm not sure that those have totally hit their stride to have sort of breakout chat rooms and interviews, but the opportunity to put out a webinar about careers or interview, or you know, even have somebody from your HR department interview a nurse. You know, what's a typical day like for that? You know, and how long have you been in this position? You know, so gives employer brand standpoint. Why would somebody want to join you? Why would they want to stay with you? I think those are conversations worth having out in social media, perhaps in paid advertising in the coming weeks and months. Going back again to that sort of retention thought, take that internal temperature. You know the saying, when you're on an airline, when the oxygen masks fall, you put yours on first, you take care of yourself first so that you can take care of others. Listen to your employees, listen to the stresses that they might be having, certainly applaud and appreciate publicly the work that they're doing. You know, but listen for those moments of stress, you know, department turnover that might be a little higher than normal. I think there's an opportunity there to, you know, arm them with self-care strategies. You know, there are inexpensive and free apps. You could bring in local wellness and fitness instructors for moments for meditation and meditation rooms and yoga and all those kind of things. And an important point in this also is making everybody within the organization feel valued and protected. You know, the nursing staff and those folks that are really on the front lines do get a lot of credit, but don't forget the administrative teams that are supporting them and folks that are in operations and you know, those areas also, you know, very important members of your team and worth highlighting them in your efforts. So thanks for joining us on this. I'm kind of beginning to sort of wrap up as we're you know, coming to the end of our webinar this afternoon. The conversation about understanding that new consumer, you know, diving in a little bit deeper and understanding where he or she are coming from and how we can sort of meet their new needs, speak to them, reach out to them, what tactics we're seeing and recommending, and even the opportunities for recruitment and retention. You know, we wanted to make this a very brief but actionable, practical conversation, you know, things that you could put into action. So we appreciate your time this morning. There's a couple questions that I'm seeing coming through, I think, that are probably more relevant on an individual basis than for the broader audience we have tuning in today, again, both on Zoom as well as restreaming on Facebook and LinkedIn. So we'll try to answer some of those questions offline, but really want to appreciate all of you. Thank you for attending. Appreciate you spending time with us today. Hopefully you found these tips and insights, you know, concise, practical, actionable. We'll be hosting another webinar in a few weeks, and we'll announce the topics and dates on those shortly. So on behalf of my co-authors, Sharon Lawless, Lisa Barone, Katie Source, thank you guys for joining us today. And again, thank you for all the good work that you do. So enjoy the rest of your day, and this concludes our program. Thanks.